Hello everyone, today we'll speak about Hunter syndrome. So Hunter syndrome is a lysosomal storage disorder known as mucopolysaccharidosis type 2. We talked about Herder syndrome and it was type 1, so this type 2. It's caused by a deficiency of the enzyme iduronate 2 sulfatase, and it follows an X-linked recessive pattern of inheritance, so it will primarily affect the males because the males have one X chromosome. So for the epidemiology and genetics, this we won't see it as much as the other metabolic syndromes, but it's frequently encountered more from the other MPS disorders. So what will happen in it? IDS gene will lead to mutations in the IDS gene will lead to reduced or absence of the iduronate 2 sulfatase activity, and this will cause an accumulation of the glycosaminoglycans. So, uh, in Hurler syndrome, you also have an absence of another enzyme that will cause the accumulation of glycosaminoglycans. So, for the pathophysiology, we mentioned already that we have enzyme deficiency, and this will lead to accumulation of the glycosaminoglycans, and this will lead to cellular and tissue dysfunction across multiple organs. So these are the signs. Nose become broad, tongue is enlarged, cheeks become enlarged and rounded, lips will thicken, enlarged head, hearing loss, heart valve issues, stiffness in the joints, growth is restricted, so failure to thrive, and compressed and damaged spinal cord. So this is a picture of the people recording the syndrome. This is another one, and this is another one. So for the diagnosis, we'll do a urinary GAC analysis. We will have a positive result. Usually it should be negative absence, but a positive result what mean will that it's increased, and this is a sign. So we will keep in our mind is Hurler or Hunter syndrome. Then we'll do an enzyme assay that will indicate that we have a deficiency of iduronate 2 sulfatase, so we confirm that's Hunter. Then we will do a genetic testing to identify the mutation in the IDS gene, and additional imaging we'll do a radiology that will show us uh, dysostosis multiplex. We can see it in the hand, in the leg, in the vertebra, and the hips. I think I'll make a video separately to talk about it because it's multiplex. For the management and treatment, enzyme replacement therapy is the best option. We will use uh, idursulfase as the primary treatment to reduce the GAC accumulation. Then we'll do a supportive care since the GAC accumulation will damage multiple organs and systems, so you'll need a multidisciplinary management. And for the other treatments, we will do a physical therapy, and we know that it will cause hearing loss, so hearing aids, and problems with the valves of the heart, so cardiac issues. We will need a surgery and maybe respiratory support if needed. That's actually everything. Thank you so much for listening. I hope you found it useful. Uh, have a great day. Goodbye.